I want to talk to you about a really common problem about tongue tie. Have you heard about tongue tie?
Yeah, I've had one.
Have either of your babies had the tongue tie release?
No.
Because let me tell you what it is. Tongue tie is really about this stringy little bit of tissue underneath the tongue that lots of babies and adults have. But it's now become a real fad to diagnose it and to release it with scissors or with laser. But it's a very confusing issue because first of all, the health professionals are a little bit confused about it themselves, so it's pretty hard for mums to understand what's going on. So I just want to tell you a little bit about it. Because you can see a stringy thing under your tongue does not mean that we have to release it. Because you can see the stringy thing under your tongue doesn't mean we actually have a problem. The whole area has so little scientific evidence behind it that it makes it open for confusion and for emotional decisions. So mums are just so desperate to deal with a crying baby that if someone suggests, oh, it could be tongue tie, they jump at it and they really want to go and get it cut straight away because they're desperate. Lactation consultants are also pretty desperate because they so much want you to keep breastfeeding and not have anything get in the way with it. So they're very inclined to make the diagnosis of tongue tie when it may not be. I understand their motives, but it leaves for much more emotion in it than actually science. So I've come up with just a couple of simple little guidelines which I would suggest for all mums. The first is that if there's a really severe tongue tie, such that the tip of the tongue is stuck down in the mouth, whether the mum and baby are having any feeding problems or crying problems or not, if it's really severe, we should release it. It's a simple procedure and we should do it. And secondly, if the tongue tie is only mild, then leave it alone unless you've got significant feeding problems with that child or mother-baby health problems with that child that you can be pretty sure do relate to the tongue tie. Because crying babies can be from lots of different reasons and feeding problems can be lots of different reasons. Tongue tie is only one of them. So if we stick to those two simple rules, then we won't be unnecessarily operating on babies and yet we won't be missing things. However, it's not just black and white like that. That's the broad guidelines. In truth, there's so many other factors. There's the factor of whether the mum's got an older child and really hasn't got time to be sitting and dealing with this breastfeeding problem, or whether she has to go back to work, or whether she's got depression or postnatal depression or whatever. There are so many other factors that cloud the issue a little bit. So in the end, all I can suggest is there are two broad guidelines I've just mentioned, but on top of that, before having your operation done, get your baby examined and checked by someone with experience and who's objective about it. And that's the only way for the mother to guide her way through it. Let's have a look at this little baby and see if he really does have a tongue tie. On dream feeding.
At night, that's how I did with my first child. Between 10 and 11, she would be asleep. I would pick her up, feed her.